take a pill, receive an injection, take some kind of medicine during their lives, impact the way we physically feel, think, and even behave.
That when that occurs and it works, it reinforces the behavior, and you start to do that behavior more and more because it feels good. It takes away the pain of the separateness.
That drug is my god.
The opioid epidemic is getting worse.
Lee County more people are addicted in this county through Ronald's story. It wasn't that uncommon. Person after person, it's a common use in the doctor's office after being prescribed that drug. And most of those deaths actually happened off the battlefield. Many soldiers became hooked and stayed hooked after the war ended.
It's prescribed for pain of all kinds, which women tended to be diagnosed with.
So if you were a white woman who could afford prescription drugs, and you went to the doctor for, say, a cough or menstrual cramps, you were way more likely to leave with a prescription for morphine than anyone else.
On the one hand, morphine use dramatically decreased, but on the other hand, this law had unintended consequences.
So heroin started to be seen as a drug of the underworld.
The median age 20 or so, is more frequently someone from a community of color, African Americans, Puerto Ricans in New York.
So morphine was the catch-all drug that doctors and pharmacists used for pretty much everything.
However, for some individuals, a first-time experience can turn into a lifelong addiction. When an individual tries a drug for the first time, he or she initially experiences a sense of euphoria. Often, the feeling of intoxication drives a user to take more of the drug. Because drug use increases dopamine levels beyond what is normal, chronic use leads to a number of compensatory responses when the user is not high, leaving the user feeling awful and unhappy, but instead is now used in an effort to stave off highly unpleasant psychological and physiological symptoms of withdrawal. Extended drug use leads to the exploitation and rearrangement of neural circuitry, instilling memories, habits, and goals that place greater importance on drug use than on natural rewards.
Any drug must first reach the bloodstream. Once there, the drug reaches the gates of its death, the brain. Neurons are brain cells that have synapses, are structures which allow the exchange of electrochemical signals between neurons.
Binds to receptors that trigger the good feelings. Now, normally this dopamine would be reabsorbed back in. However, crack alters this process, the reabsorption, allowing dopamine to build up and continually stimulate the receptors. As a result, you feel, well, really good for about 10 minutes. But soon after, the dopamine levels in the brain plummet, causing an extreme low and often feeling depression.
And that's what you find out with most addictive things, that they give you a short rush, but they don't allow you to remain at home. They just allow you the taste of it.
It also activates noradrenaline receptors, which increases the heart rate, dilates pupils, and triggers the body's fight response.
But warriors are people who think of all the variables beyond their control and what might happen. So what you do is, you go through the motions
Substances
of thinking out what you will do about this.
Amphetamine,
And then when the time comes to act, you make a snap judgment.
SSRI, tranquilizer into effect medicines. Drugs have the power to alter the brain's chemistry, and repeated use can permanently rewire the neural networks that support our ability to think, make decisions, learn, and remember things.